All right, fantastic. We have a great showing. Thank you so much for joining us for this opportunity for the states to deal with some question and answers associated with the implementation of ET3. Thank you so much for joining us. We've got a great representation on the call. Very much appreciate your time. We've been doing lots of work together over the last few months in trying to prepare a number of extensions to NEMSIS that would allow just the NEMSIS data set to be able to answer the questions that will be posed by the ET3 model. And I've received just great collaboration from the CMS side of the house implementing ET3, specifically CMMI, and having them learn about NEMSIS, understand the standard, which, as all of us know as state EMS data managers, takes a little bit to figure out, a little bit of time. And they've done a great job with that and have been able to really implement some revisions just through custom values and custom elements and a custom schematron that's been released for vendors to use to allow the questions that will be posed by the model to be answered. What we hope to accomplish on this call is to give the states a chance to understand how the model might influence EMS at the state level, how the data will flow, how we can best incorporate the needs at the state level for those who have EMS agencies or other participants participating in ET3 within their states. How can they best work with them? So I'll just briefly introduce some folks if I can, and then we'll just move right in because we have just a lot of information to cover. Mr. Eric Cheney is on the line with us from the Office of EMS. He is basically our contracting officer for the NEMSIS Technical Assistance Center to the Office of EMS at NHTSA. Dr. John Cromer is also on the call. A pleasure to have both of you. And I'll just mention also that we have some great folks from CMS on the line. Two folks that we've been working a lot directly with, Neil Milan and Brenda Staffen, have done just a great job of implementing the NEMSIS standards into their data collection. And really, the lead on the technical piece of that, making everything work, has been John Beckett, so he's often with us, or he's also with us. And there are others on the line. Alexis Lee has been helping with communications as well, so happy to have Alexis with us. And there may be others. I'm going to try to keep introductions to a minimum just because we have a lot of information to cover. So I'm going to go ahead and move to the meat of the meeting. And I'm going to ask, looks like I can go ahead and share my screen. I'm going to begin perhaps by indicating to each of the states where they can access some question and answers that we have prepared for states. During the V3 implementation meeting a couple of weeks ago, and then also just over time, states have asked a number of questions related to the implementation of ET3. We have developed a document that we're going to go over here in a little bit of detail. It's found under NEMSIS 101, here under using NEMSIS data. This is a new section that has a lot of great information for state data managers. We go down here towards the bottom, there are a number of resources associated with ET3. Here we have posted some question and answers to for questions that states have already posed to us. So we're gonna go through a number of those questions, and I just have that document pulled up here in a little bit of a magnified form. You'll note that there have been a number of questions that have been asked. Those that are in bold, if you want to open up a copy of it, are questions that already have a draft answer associated with them. Then there are some questions, there are 4 or 5 questions specifically that we wanted to pose directly with this group in a discussion format. So we'll first briefly review these question and answers in bold. Josh Legler will bring us through that piece. And then we'll kind of enter a section where we hopefully can talk about some approaches to these questions where it may be more valuable for us to have a back and forth conversation. And then I'll just mention that there are some questions that have been posed by states that CMMI is still potentially formulating answers to, and need a little bit more information to make sure that we answer them as correctly and accurately as possible. So we won't be covering those questions today, but we will be filling out this document that's present under NEMSIS 101 as we develop the answers for the additional questions. So any questions related to the format before we get going? All right. All right, so feel free to open up this document. I'll keep this up as we walk through the questions. Josh, do you want to go ahead and begin to walk us through the questions that are bolded and have answers for them?
Yeah, I'd be happy to do so. So we'll go through these at a fairly brisk pace so that we can leave time for the questions that we know we want some input from all of you on and some discussion on. So we're going to go through these bolded questions, starting with number 2. Will the EMS data for ET3 come from the states? And will state data include the ET3 custom values? Agencies will submit data directly to CMS as they participate in this project. If your state would also like to receive the custom element data that ET3 is requesting from their participants, then that will be a task for you at the state level to ask your agencies to submit that custom data to you. Maybe a little bit like the CARES project. If you're wanting agencies to submit their CARES custom elements to your state, then you have to let them know of that requirement at the state level. Question number 3 is related. It's how will this work for agencies that are submitting directly to state-supported web-based software? So many of you have systems where you have agencies that directly use your state system. They don't have their own product that they're using at the local level. If you have any ET3 participants in your state that are directly using your state system, then you'll need to be involved to some extent with their ET3 participation. So for example, those agencies would need to implement the ET3 custom data elements. You would need to be involved with your state software vendor to make sure that those elements are available for ET3 participants to use. You would probably be involved a little bit with your state software vendor to help set up the data submissions to CMS for their patient care reports. And those agencies may be transporting to new facilities that are not typically included on the list of places that EMS would take a patient. And so those agencies may need to add some facilities to their facility list in your state system. So that's where it gets to that kind of gray area. If you're directly providing a state product to agencies that don't have their own product, then yeah, you're going to have some involvement to support those agencies in their participation in ET3. All right, Clay, let's go ahead and move down to question 6. What will happen if we need to correct information on a PCR that was previously submitted? The answer here is the same as it is for submissions to the national database. Agencies can make corrections and they can just resubmit their PCRs to CMS, and CMS will recognize those as updates to existing records and process them accordingly using the same criteria that the national EMS database does. Okay. This is a stickier question, number 10. Do states need to add facilities and facility types to NEMSIS or to their state systems for ET3 participation? And where will the information about these facilities come from? Again, if your state is, if you have agencies that are directly using your state system, you'll need to be involved in helping them set up additional facilities that they are partnering with for the ET3 project. They will have a specific list of facilities that they're partnering with that they will get approved by CMS. So each agency will know exactly which additional facilities they need for their reporting. For agencies that don't use your state software, then there's less of a dependency there. However, a lot of states do have data validation rules that restrict destination codes to be a code on a specific list provided by the state. So that's something you'll want to think about at the state level. If you have agencies now transporting or transferring care to new partner facilities, you want to make sure that when they send their data to you at the state, you're not rejecting their data because they took the patient or transferred the patient to a place that you don't recognize at the state level. So there will probably be some work to do there. Okay, let's go ahead and continue on down. Number 13, has the ET3 project considered NEMSIS 3.5? Yes, we are actively working with the ET3 team on the publication of the 3.5 quote unquote state data set for the ET3 project. So that'll include the ET3 custom elements in 3.5 format and the data elements that ET3 will collect from in the 3.5 version. We will also publish a schematron schema for 3.5. The data elements and the rules in the schematron schema, these are all going to be modeled the same as we've done for NEMSIS 3.4. And so the only differences will be differences that are necessary because of the different structure between 3.4 and 3.5. For example, in 3.5, the disposition elements are quite a bit different as we replaced edisposition.12. So there'll be some differences there at the technical level. Those resources will be forthcoming. So agencies can participate in ET3 using NEMSIS 3.4 or 3.5. Number 14 is it a requirement that participating ET3 agencies be submitting their data to the states? Or is it possible they could just send their data to ET3 and not send their data to the state? Participation in ET3 is independent of any existing data submission workflows. So when an agency begins participating in ET3, it will have no impact on their existing relationship in terms of whether or not they're submitting data to your state. Okay, and number 15, did ET3 consider using new custom elements, standalone custom elements, rather than extending edisposition 21, which is type of destination, and edisposition 12, which is incident patient disposition, and edisposition.21, which is type of destination. ET3 did consider doing standalone data elements, but went ahead with extending those two existing elements with their custom values. There's a couple of reasons for this. One is that it minimizes the number of new data elements for EMS personnel. So we simplify the training needs at the local agency level. And go ahead and scroll a little more there, Clay, and we'll get the rest of the bullet points on this one. So in addition to minimizing that additional burden, also conceptually, there are ET3 dispositions and ET3 destination types that are already covered in the standard in edisposition.12 and 21. So if they made standalone elements for some things, they still have to go look at the standard elements for other aspects of evaluating the ET3 project. And also, by extending these elements, we allow existing national and state validation rules to just continue to work as they are, because these elements, these new values have fallback values that we have carefully chosen. Okay, we're going to skip down to 21. How will we know which agencies in our state are participating? There are 36 states and the District of Columbia that have one or more agencies selected for participation in ET3. This FAQ document has a link to the list of selected applicants. And right now, CMS is going through the contracting process or participation agreement process with those agencies. So it is possible that some of the selected applicants will drop out and not actually sign the participation agreement. But they have until December 15th to sign and submit that participation agreement. And once that deadline has passed, CMS will be able to publish a final list of the agencies that agreed to participate. Okay, question number 22 is another one of those more difficult ones. How likely is it that partners that ET3 agencies work with are already listed as facilities in our state systems? The alternative transport destinations in ET3 may include things like urgent care centers, clinics, mental health centers, addiction treatment centers. Those are all facility types that are currently covered in the NEMSIS standard today. And some of you may have facilities of those types on your state facility list. And some other states do not. For example, I'm here in Oregon where the state maintains a list of hospitals, but not the other facility types. The treatment in place partners, it's important to recognize that those could be organizations, they could also be individuals. And these are less likely to already be on your state facility lists. We ran a couple of examples just to kind of see what was out there. So here's a couple here. American Medical Response of Maricopa in Arizona is a selected participant for ET3. And let's say, for example, this is hypothetical, that they begin transporting patients to the 7th Avenue walk-in clinic in Phoenix. It's an urgent care center. And that clinic is currently listed on Arizona's facility list as an urgent care center. So they would just use the code that Arizona has assigned for that facility and take patients there. A second example, let's say Southwest Ambulance of Southeastern Arizona. They are also a selected participant. They begin transporting patients to the Gila Valley Clinic in Safford, Arizona. That is a rural health clinic. A rural health clinic is a designation that ET3 has designated as important to track for their project. The fallback code for that destination type would just be medical office / clinic, but ET3 wants a custom value for destination type that represents that it's a rural health clinic. And the Gila Valley Clinic is not currently on Arizona's existing facility list. So Southwest Ambulance would begin transporting to that facility. They would probably need to notify the state that CMS authorized them to transport to that facility. And at that point, that's where the state would decide, well, do we add that to our state list? Do we just let Southwest Ambulance submit those calls and we'll get the code, we'll get the name of the facility, how much oversight do we want in terms of that facility? Okay, so, oh yeah, last one here. Why weren't the ET3 custom elements and values incorporated into a release of the NEMSIS standard? Instead, they were done as custom elements. And we just remind you that ET3 is a model test. So CMS is going to be evaluating ET3 over a period of several years and then decide whether to operationalize it for all of the agencies that bill to CMS. So if it's operationalized after several years, then we anticipate there probably will be some changes that would be incorporated into a future version of NEMSIS. But since it's a model test, this really is an ideal use of the custom element structure in NEMSIS, really one of the things it was designed for. So those are the questions for which we've written those answers already that you can read through. And you may want to ask some, for some clarification today on some of those questions. So we're hoping that we'll have enough time to allow for follow-ups on those questions. We want to make sure, though, that we can prioritize the discussion items that we've selected for today as well. So Clay, I'll turn it back to you.
All right, thank you, Josh. Appreciate that very much. Let's pause for a moment and see if any of the states had any questions or would like some clarifying information about any of the information contained in this document so far.
Hey Clay, this is Amber. I'm just trying to figure out if we have a rural health clinic that we also consider a hospital or a freestanding emergency department, how we would determine which facility type to list them under.
Yeah, so good question. Maybe if it's okay, Neil, I think we've queued up your team a little bit. Do you want to talk a little bit about the designation of, for example, a rural health center and kind of help folks understand where that designation kind of comes from and why it's chosen, and then maybe we can help Amber with this idea of it already being assigned a different type of code currently.
Sorry, getting off mute. So first of all, great to virtually meet all the state representatives on the line. Ma'am, could you repeat the specific scenario that you had in mind again, and we can talk through the codes and as Dr. Mann had pointed out, the kind of the basis of those designations?
Yeah, sorry. This is Amber in Colorado, and this is a question that keeps coming up in my head without actually, being able to dig into the facility list and how we're going to implement it. My fear is that there'll be a facility that maybe we already have in our facility list, say a rural health clinic that we consider a hospital or a freestanding emergency department, or something else. How would we determine which facility type to assign it if it could potentially be more than one?
I see. And then, so the question to me also comes up in two ways, right? So it would be how you would track it at the state level, but also for the agency, how they would follow through with submissions to ET3 so that we can also track it from our data needs. Is that also a correct consequence of this?
Yeah, exactly.
That's one of the items that I think, Josh, we had talked about trying to dig into as, where some of these overlaps and conflicts, whichever way we want to phrase it, exist. I think this is one that I think, thank you for providing a specific example. And it's probably one that I'll have to take back to the ET3 team and see if we can get some sort of consistency with how we will match up those facility codes, as in which one wins out, right? As a way that hopefully it also makes it easier on you at the state level to track too. But this is one of those very good questions that, or the scenario you provided is good, because you're right, those are existing elements and which one wins out when they're potentially conflicting on these lists. So I apologize, I don't have a direct answer for you, but that is one we will have an answer for you later. I think it's just a matter of figuring out the kind of priorities, which ones win out over those possible values.
Yeah, no, this is Clay. Let's dig into this, because I think this will be a question among many states. So say an agency is participating in ET3 and they indicate those partners that are also participating in the model. How will the individual agencies know, like, for example, that this hospital or this freestanding ED is designated as a rural health center? Will they report that to the state, or is there another location that CMS makes available for you to enter the name of a hospital and find out how it's designated for ET3? The facility type, what facility type it would be associated with?
Sorry, was this a question for me, Dr. Mann?
Yeah. So yeah.
So there are lookups. Like I think you can do it by NPI lookup, and you can see whether a facility has those federal designations. So that's one way. In terms of your direct question about how to feed the information up, did I get that correct? Or so the first question was yes, how to find out what a facility designation is. So you can do an NPI lookup, and you'll see any federal designations that are there. And then the second part of your question, Dr. Mann?
Was really, I think that I'm just assuming here, right, that agencies can report to states, those that are participating in the model, in their submission that was approved. They may not be reporting the CMS designation type that you'd like to be associated with their data. They just may say it's St. Joseph's.
Right.
In fact, that needs to be a rural health center designation. And so it looks like what you're saying is if they receive like the name of a freestanding ED or something that's participating, they could look up in, through the NPI number to identify their federal designation type?
Correct. Correct. So what we've received from participants as part of their application were some of these facilities, but they didn't say as part of that information whether it fell under certain federal designations. So that was not included. That's something we'd have to look up separately, yes.
Okay,
Yeah,
Josh, could you speak a little bit to the vision we've talked about for this idea that Amber has? That's a really good question, right? They've already designated a facility with a type, and it's not going to agree with this federal designation. What do they do in those instances?
Yeah, right. And of course, right now the question is hypothetical because we need some actual facilities that an agency has decided to work with so that we can look them up and see. So I want to just kind of let you know what we've seen so far. First of all, federally qualified health center and rural health clinic are federal designations. So it's not just the fact that it's a medical office that's in a rural place. This is a federal designation. And those are available in the NPI system. So if you go to the NPI system, do a lookup, you can search for those terms specifically, and you'll get a list of all of the places in your state that have those federal designations. And so I've done that in several states and just looked through the list of places. And I didn't find any that seemed to also be hospitals or standalone EDs. What I did find was several facilities that where the license holder was a hospital corporation, but it was a separate and distinct location. It was not, you know, if I looked on the map, I saw that it was a different building. It was not the hospital. It just happened to be owned by the hospital corporation. So I didn't find any that were also hospitals. Now, not an exhaustive search, so it could come up. There is that potential. And so as Neil was saying, then I think that idea of having kind of the precedence. So if a place is, you know, this exists in NEMSIS today, right? If a place is a hospital and it's also a clinic, that's a challenge for us today because we only allow the EMS provider to record one value for the type of destination. So I think that, as Neil said, will have to be prioritized so that, okay, if that place is both, if it's 2 or 3 types, which one is the most important type to list, and probably have to go with that.
Yeah, Amber, does that address the question?
Yeah, I think as Josh mentioned, these are all hypothetical. So once we have a facility that we can talk through, that'll definitely be easier because I'm looking at my list in Colorado right now, and you know, I see Delta County Memorial Hospital is also a clinic / center rural health. So I'm assuming that's what you're talking about.
Yes.
And that's my fear is that, yeah, there's the hospital, but then maybe there's a satellite location, but in our state that's still listed under the same license as the hospital is potentially. So it's just, I think it gets muddy really quickly, and would definitely just love to provide the most useful data to the federal group, but also not change our existing kind of processes at the state level.
Yeah, that's a good example, Amber. That was one where they have both a hospital designation as well as a rural health center designation, or is it just the name of the place had the word hospital in it?
They have both. Delta County looks like, and this is my first experience looking someone up on the NPI registry, so
all right.
excuse me if I'm doing this wrong. But yeah, it looks like they have the general acute care hospital, but then the rural health center listed as well. But you're right, with 2 different addresses, but the same name. And so for us, we would license them under the same license number in the state. So just trying to figure out how we're going to work through decisions like that. Again, like Josh alluded to, we've run into these before where sometimes they are multiple different facility types. And the only ones that I really honestly prioritize are the ones that are hospitals as well, because we have so many criteria and analyses that are based around hospitals. And I know in Colorado, a lot of our rural, we call them rural health, maybe they're not clinics, rural health centers may also be rural health clinics. And we also consider them hospitals because they fall within our trauma system. So just putting it out there. Thank you.
Right, ma'am. And then actually to your last point, that's part of why we made such a point about these custom values of these elements. Is there are certain facilities we'd really like to just see what's happening, especially when it comes to the alternative destination of ET3. So having good data that really tells us what's happening on the ground is very useful as well for our analysis, and just really seeing what is happening with alternative destinations.
This is Anne in Arizona, and I know Josh gave an Arizona example, which is a good one. But we do have a lot of urgent cares, clinics. Basically, anytime somebody wants me to put something in there, I find a way to put it in there if they want to list it as a destination. In our state, we have freestanding EDs that used to be licensed under the same ID as the hospital, even if they were located at a different location, but that's changed in the last couple of years. They have their own licensing number now. But I go by the state issued license facility ID that our state licensing provides, and then also what they are designated at per them. And I have a feeling that it's not going to match necessarily what the ET3 is, but we want to match our own licensing so that everything kind of matches across databases. And I do have that same concern if it's not a multi-select. I don't want to lose the specificity of the data that we use, especially if it comes in conflict with our state licensing database and doesn't match that. And I'm just concerned, and I know without a specific example it's hard, but I mean, we definitely have urgent cares that might also be considered a rural access point, but I would call them an urgent care in my system. I wouldn't want that overwritten because then I would lose the ability to pick out that they're urgent cares versus freestanding EDs versus acute care hospitals versus behavioral health center floors within a hospital that's licensed separately. Does that make sense?
Oh, yes.
Yeah, it makes sense. So we'll need to look into these. We can take a look and say, for these places that are urgent cares or that are freestanding EDs in Arizona, per Arizona licensing, do they also have these federal designations of FQHC or RHC? We'll see if we find any.
And right now, as far as I know, nobody who uses our system directly in an enterprise license has applied to be an ET3, but so it may be more of an issue of what people are sending me, and I'm willing to kind of accept without losing, like I said, that specificity. But I think down the road, if this takes off, of course, we probably would have agencies that would be direct users. And then I'm also kind of looking at almost two pieces, accepting something, if they're mapping it, maybe, and then when we have to alter our own system, how that's going to play out. So that's it. That was my comment.
Yeah, and good comment. Yeah, it'll be valuable to actually work through some of these specific examples once we get some facilities in our hands, and we know that they're going to be participating. That'll be helpful. Yeah, great questions. Great questions.
Dr. Mann.
Oh, hi, Juan.
Yes, I was thinking about, excuse me, I was thinking about the process of the way medics enter data. Usually most of the time they select the facility and the type of destination is pre-configured by the software based on their demographic section. Those custom elements are not in those custom values are not in the demographic side. When we have to add them?
Yeah, they're not in the demographics side for the ET3 project because ET3 will not be receiving demographic data from agencies. However, agencies do need to be able to set up those facilities in their agency setup. And so it's likely that they'll want to add those facility types or need to add those facility types on the demographic side within their software. Whether it exports the data or not won't matter, but they'll probably need them.
Yeah, good question, Juan. Yeah. Were there any other questions that popped up in folks' heads as we went through these existing Q and A's? Okay, all right. We're doing great. We're getting through a lot of great information. This has been incredibly helpful. Let's just maybe go through a couple of quick questions that we mentioned were not answered on that list, but we wanted to make sure that we had a chance to talk about those together. And maybe perhaps the best way to start this is maybe, Neil, just talking a little bit about the data flow, just making sure that the state folks on the call kind of understand really how the data will flow and how closely it mimics what happens now in regards to NEMSIS.
Sure, Dr. Mann. Yeah, thank you. I know there's a lot on this diagram. We intended it to be a fairly comprehensive diagram, and you'll find it on the NEMSIS 101 site as well too, along with an explanatory table. As you can see, different arrows are labeled with a number letter flow in there, so you can see the references. What I'd like to do is just highlight 3 data flows that will encapsulate what is currently being done, as well as what ET3 proposes to have once the model is live. If you look at 3A, 3A, 3B, and 3C, what we're showing there is that as a result of a 911 call and a response, right, there's the EMS agency shown with a little ambulance there. There is a patient care report that is generated either directly by a participant or through the assistance of a software vendor. And then from there, the patient care report, as is currently being done in flows 4A and 4B, that patient care report is sent to states, and then a subset of that is sent to the national NEMSIS database. What ET3 is in line to do with what we've developed on our IT systems is to not redirect the flow, but have a separate flow where that patient care report is also going to us, which you can see in flows 5A, B, C, and D. And that flow is just broken up just to illustrate that there'll be 3 different levels of validation of the PCRs that we receive from participants. So there's the XSD validation, the national schematron validation, and then the ET3 specific rules, since we're treating ET3 as a state data set of sorts. And all along the way, there are status code messages that the different participating agencies or their software vendors will receive as part of their data transmissions. So I think the key summary is, if you just look at that blue block that says patient care reports, you'll see that we're intending to not interrupt anything that's the current process and flow for data submission to the states. We're just turning it and getting a second flow that goes directly to ET3 and therefore CMS systems. That's really what we have in mind with this. And I hope that answers a lot of the questions about who's responsible for the data submissions that I think we had on that list. So with that, I think I'll take a pause, and if there's any questions on this flow that we propose, I'm also happy to go over any other aspects of the flow just to give you a broader overview of how data is moving between participants and ET3.
So one specific comment maybe to call out is, you'll note that the 5 series doesn't include a state schematron file validation, and that is by design. So the developers will ensure that the records that are going to ET3 pass through those 3 levels of validation, but does not include the state schematron file. And we did that on purpose, just because it would be very, very difficult to ensure there weren't conflicts between now what would be at least 3 schematron files. And so the patient care reports that shows up in blue, as that passes from the ambulance and will end up in the state repository, those same records that are also sent to the state will pass through a state level schematron file on that path to the state repository.
Yeah, and one other thing to note there as reasons for that is if ET3 was also passing everything that they receive through the state schematron file for the state in which that agency operates, then ET3 would have to start putting themselves in the position of supporting state rules in terms of, you know, when the agency asks, why did you reject my submission? And ET3 has to say, well, it's because of a rule that your state has. So that's a lot easier to keep that flow between the agency and you as state data managers. You are equipped to answer that question about why something may have failed state validation.
Is there any further questions on data flow? Okay, great. And here's the key that that Neil mentioned. This is associated with a document that's found in the NMSIS 101 location on the website. Let's go ahead and handle just a couple of these questions that we talked about that we wanted to have a more direct discussion about. So the first question is, what will states have to do or not do for ET3 agencies reporting directly to ET3? So we attempted to cover a number of these topics related to whether or not an ET3 participant uses a freestanding software product, one where they're not utilizing a state level product that's provided a mechanism for states to be able to submit directly to the state. That's a much easier case. For those of you who have ET3 participants that are going to utilize software that's maintained by the state and is reported directly to the state, then there is some work to do. Are there any other questions related to this specific idea? Okay. How about this question? What is the best way to keep state EMS data managers in the loop with the data that participating agencies are submitting to ET3? So I assume here, and I've heard from some states, for example, New York is a good example, where they would like to see the data that's being collected regarding ET3 have the ability to look at that data and determine how things are going with the ET3 project. And I think Josh just mentioned briefly that if that's a desire of your state, that you could work with your vendor to ensure that you also received that ET3 specific values and data. Are there any other kind of thoughts about this? And we can take this question much more kind of universally. Is there an additional communications loop that we need to develop on top of the V3 implementation calls that lots of states participate in? We have a standing section in that call now that's associated with ET3. Are there other kind of communication loops that we could close by providing some other mechanism for you to ask questions to ET3 or to pose ideas? Are there other thoughts from states about improving that communication process? Okay, well, if any jump to mind, please, please pass them off to us. All right, the next question. The program is scheduled to go live.
It looks like there was something in the chat.
Oh, yes.
Yeah,
sorry,
Dr. Mann, there's a question in the chat.
Thank you. All right, can someone read that for, oh, there we go. I can see the chat now. Okay, so Emma Brown asks, are there current communications between ET3 and participants that states should be a part of if we are part of the submission process? That's a great question. Neil, do you want to take that?
Yeah, ma'am, if I could clarify the question. This is for the situation that the state is the one responsible for the data submissions, right? Is that what you're specifically referring to? If that's the case, I think what we had planned for, the communications where you have vendors supporting, I think would be perfectly applicable to the state in those situations, and you're essentially serving the same function. So we did have plans for software vendor communications, the ones that support our participants, and for those states that basically fulfill that role, I think it would be perfectly aligned with that same process. So any follow-up questions there, ma'am, or does that answer it?
I'm not sure if you guys can hear me now. Are you able to hear me?
Yes.
Okay. Yeah, I just want to know, how do we make sure, I know that of all the folks on this call, some folks are in that boat and some folks aren't. And so how do we self-identify and say, hey, I know that I should be one of those people and want to be looped in?
So I think a quick takeaway is probably if Dr. Mann, or I don't know if there's a state level who knows what states actually have that situation. So we know on our part that to make sure for the participants in those states that they're looped in on that. I think that would be a good starting point for us, is just knowing which states are in this situation.
Yeah, that makes really good sense. I guess perhaps we could, at the NEMSIS level, we could go through all of the agencies who qualified for participation and look to see what product they're using for the submission of records. That might be somewhat helpful. That might be an easier beginning approach than states reaching out to all of the agencies participating and asking them. So we can develop an initial list, but I think we need to renew that list, right, Neil, as you get final signed participants who are signed on, and have to make sure that we're aware of the software they're using.
Correct, yep.
Clay, this is Eric. In addition to that, at a more macro level, all of these meetings or any of these meetings where we have discussions related to general exchange of information on how this process is going to work, we'll make sure that Dia and the SEMSO have for distribution to the state directors, and Rachel has for distribution to the state data managers, as we've been working with them in the past. And then the vendor group that we use through Google Groups as well. So, I don't know of any meeting that we've had to the point that, we haven't tried to open up as broad as we possibly can. And as we move forward, I don't want to just limit it to states that are participating now, because there may be some state data managers who are on the fence, or state directors that are on the fence, as they start to expand ET3 beyond the existing initial group, that want to learn from some of the lessons that are being learned at this point. So I don't want to eliminate anyone for participation and getting understanding of what's going on. And we'll certainly make that information available to all the groups that we work with at NHTSA. And if there's others that are identified, Dia, Rachel, any other NGOs on the group, by all means, let me know who they are, and we'll make sure they're included. Over.
One kind of just addition on that, this is Emma again, is as a state data manager, when I'm looking at, scheduled like meetings and stuff that are coming up, I wouldn't always look at one labeled for vendors who are working with ET3 and think, oh, as a state manager, I should attend that. But having been on this call and heard that suggestion, given my situation and knowing that I'll be helping some agencies directly submit, now I'll look out for it and say, oh, there's a vendor call for ET3. I should probably be on that for awareness. There might be other folks that aren't on this call today or who weren't able to make it that we may want to kind of call that out for, or even if you want to kind of co-brand some of those things as vendors and, optional state data managers or something like that, it might be helpful.
We can certainly do that. We'll put in the meeting invitations from now on. Like the ET3 will be the general topic, but we'll put a list of who we think should participate in the initial opening line. So like this meeting should be attended by state directors, medical directors, data managers, vendors, both participating in and not participating in. We can go that far even. But thanks for the suggestion.
Yeah, Emma, and I think once we have the list of agencies, right, we'll be able to solidify pretty quickly who their vendor is and be able to work like that. And yeah, thanks, Emma. It's good to ensure that we make a point of ensuring that state data managers who are in this situation we're talking about, that they have the opportunity to participate in those, and we'll do that. Amber asked if I could add the link in the chat where they could find the list of ET3 agencies that have been approved for participation. Josh or Neil, could you post that? I know that both of you
Clay,
probably have that pretty handy. Okay.
yeah, either way. Yeah, and I was just going to say, I would recommend looking at that list. And so Emma, for example, there are 4 agencies in Wisconsin that have been selected for participation. I bet if you look at those 4 agencies, you'll know as the data manager which of them are using their own products and which of them are using your state system.
Yeah, I'm aware. Thank you.
Yeah, thanks, Emma. Great questions, great questions. All right, let's go on to the next question. We're doing great on time. This is super. All right, what data may be relevant to the state EMS data manager or state? So again, this is a question from a state that an early on question. We've pretty much answered this, I think, but just wanted to see if there are any attributes of this question that state data managers still have some question about. Right, I think overall the data that's being collected is specific to the ET3 model and will be submitted directly to the CMS enclave, just directly. There'll be fallback values when the data is sent to the state for the custom values that are listed, but there'll clearly be states that will be interested in looking at the CMS data as well, like New York, and we have spoke to that idea that they can work directly with their vendor. Any other questions? Okay. Okay, here's a great setup question. Is there anything that the ET3 agency may be doing that would be not allowed by state regulation? So this was clearly a question we wanted to bring to this group now that you have probably a better understanding of how the data will flow and who will be receiving what data. Do any of the state data managers see a direct conflict with any regulations that are present in your state?
Yeah, for example, do any of you have rules that would prevent agencies from transporting to places that they haven't transported before traditionally? Or turning over care of a patient to a telehealth provider or a non-EMS provider on scene?
So just for the point of discussion, in Maine, we don't have specific rules that would prohibit that, but it's just not something that the rules consider at all.
Yeah. Yeah, Jason, that's probably true in a lot of states. Yeah, that's a good comment. Okay, good. Well, if there's any other questions as this mulls around in your head a little bit, feel free to reach out to the NEMSIS Tech. We'd be happy to help you investigate that and work with the ET3 group related to that as well. All right, so really the last slide, those are all the questions. Really the last slide, we wanted to make the state data managers aware of this, of the continued work that we're doing with vendors. We invite all the folks on this call to join us tomorrow for our bi-monthly V3 implementation call, where we talk with the vendors and discuss many issues associated with ET3. This will be a major topic tomorrow where this week, there's an initial opportunity for the vendors to gain their onboarding registration work, to do that with the technical team at CMS. so that they can work through the processes of ensuring that they can connect correctly to the ET3 enclave. And this will be the first opportunity, if they're ready, to try submitting some test data and determining if it flows correctly, if it passes through the schematron file correctly, all those type of things. And this will be an initial opportunity for the vendors to do this. And John, I know, John Beckett, I know that you've been in conversations this week as to what potentially other opportunities might be available. Do you have any other information on that directly, John, to pass
Yeah,
along?
sure. Yeah, sure. Yeah, and things are kind of really shaping up this week because we did plan to have our testing starting this week for vendors. We're still going to stick with our plan. The dates currently we are looking at is Thursday. Between 2 and 3 o'clock, we're going to plan for a meeting so that the vendors that are interested can come in, and we'll give them an introduction and give them some, some early understanding of what the registration process looks like. And so we'll walk them through that, and then it'll be on their own. They'll be on their own to go out and go ahead and do their own registration, of which at the end of that, they'll receive security keys. And those security keys will be something that will give them the access to submit PCR reports. And we're prepared between Thursday and Tuesday of next week, the 21st, to just accept those transactions coming in. And they'll receive the proper responses, whether they're success or failures. So, that's pretty much how we've arranged this, and we are looking forward to coordinating with those vendors and just, exercising this for the first time with vendors.
Right, Dr. Mann, we made a slight change to keep in mind the implementation call that you have tomorrow rather, that you have tomorrow, and as well as spacing the window out for submission. So it's not too much of a crunch on those who do want to participate. The only real time commitment is to go through as John stated out, just the initial overview of how to access and get key access to it. But from there, the data submissions, we'll be standing by for support, but we just figured that spacing it out a little better is a lot more feasible for testing. So there's more flexibility in the schedules for vendors.
Yeah, thank you. And once we get this process under place, so there's a lot of things that are kind of gelling together, but we'll do our best at the NEMSIS TAC to keep track of who has successfully tested, and so that we can keep each of the states aware of the vendors who have completed that process, and so you can have some assurance that the vendors that are working in your states that will be participating in the model are testing and have gone through this process and are ready to go. There was a short timeline associated with this whole thing, so we'll do our best to kind of keep you in that loop as things begin to gel. Any questions related to the process? The vendors will be starting to gain their security keys and then to be able to send test data. All right. Well, fantastic. That was really the end of the formal presentation. I hope you found this to be valuable. Are there other questions that have come up that we're running up against the end of the hour? We could certainly take those questions and ensure that we answer them tomorrow on the V3 implementation call or at a future call. Are there any other topics or questions that folks feel like would be important to cover? All right, we will do our best to keep filling out that document that's specific to state data managers with Q and A's as they come up. And so you can always look for a refresh there under NEMSIS 101. And always feel free, if there's a question that crosses your mind, to contact anybody at the Technical Assistance Center, and we'd be happy to pass that on to the proper folks that could best answer. So really appreciate the opportunity to meet with ET3 today. It's really a great collaboration, and I'm really thrilled that they are as integrated with us as they are. Will really make this really happen in a much smoother way. And we are very grateful that you were willing to join us from the States. And again, if you have any other questions, feel free to reach out to us. Any other comments, Neil or Josh or John, Brenda, and Janelle, welcome.
Dr. Mann, just say on the behalf of the ET3 team and CMMI, thank you so much for organizing this and hosting it. And thank you so much to the state representatives for spending the time with us and going through these questions. Really appreciate it.
All right, thank you, everyone. Feel free to join us tomorrow for the V3 implementation call.